On behalf of AMA Private Practice Simple Solutions, welcome to Marketing Primer 2, conducting market research to gauge community needs and patient satisfaction. I'm Rob Rosenberg, President of Springboard Brand and Creative Strategy, who, along with my colleague Donna Arbogast, will be developing and presenting the content in this marketing series. For over 30 years each, we have worked with healthcare brands on the development and implementation of marketing programs using market research to determine unmet needs in the community and organizational attributes and advantages. This primer will explore how private physician practices can better understand the role and methodologies of market research and the insights it can provide for marketing and planning. As discussed in Marketing Primer 1, which is also available online as part of this series, market research is an effective tool for physician practices to identify their marketing advantage and meet the needs of their communities and patient base. Please note that an accompanying learning guide for this primer is available online. It includes exercises to help you and your office staff determine how to access and use existing data, and if others suggestions for how to survey your patients to better understand their needs and the experience they have with your practice. Specifically, the agenda for today's primer includes the following. First, an overview of both primary and secondary research in marketing. Both types will help you understand your marketplace and identify ways to differentiate your practice. We'll explore secondary research closer to uncover where you can gather existing information about your marketplace and what kinds of information will matter most to your practice. In addition, we'll discuss the importance of primary research that you can conduct to gain valuable patient perspectives and insights into their needs and satisfaction with your services. Once all forms of research have been explored, you'll be ready to identify priorities and conduct an action plan for your practice, helping it grow and sustain ongoing success. Well, let's get into it. The use of research in marketing goes back a long way. Since the basic definition of marketing is the creation and development of goods and services to meet the needs of target audiences, research is a fundamental tool to help determine those needs, which is particularly important in healthcare as it has become more patient-oriented and consumer-facing. There are two basic forms of research, primary and secondary. Primary research is when customized studies are developed to identify specific insights about a product or service. These studies can include quantitative research, such as surveys and other forms of numeric statistical data, or qualitative research, such as interviews and focus groups that help ascertain customer preferences. Typically, these types of proprietary studies are more costly and require additional time. Secondary research is market information that already exists about your practice and/or marketplace. Whether this is published data, articles, or other research studies, this kind of information is more readily available and faster to access. Before conducting primary research, many marketers review existing data and information to determine gaps or comparisons that should be made to their specific brand. This information can be gathered through secondary sources, which we'll explore now. We will be reviewing where to find information about your community and patients, what to look for that may be valuable to you, and how this can all help impact your practice. We're going to start by reviewing where to find information about your community specifically. A great deal of the data that will be useful for your practice is readily available online. For example, you can learn about the population in your community by exploring census data provided by county, state, and federal websites. You'll be able to identify basic demographics about your community, such as age, income, ethnicity, and education, as well as where any growth is projected in your marketplace. For health behaviors and information, look to the CDC, your local health department, and even your local hospital's websites to help you identify your community's needs when it comes to healthcare usage and services. Of particular interest may be the community health needs assessments that local hospitals are required to conduct and publish on their websites. They are invaluable resources as you begin to develop a picture of the community you serve. As you access these resources, you will want to be looking for information about such issues as the prevalence of diseases in your community, particularly those relevant to your practice, such as diabetes, obesity, blood pressure, or certain types of cancer. Secondary research into your market will also help you know the occupational risks in your community, such as back injuries or other types of job site risks and exposures. After gathering this important data and information about your community, you can begin to work with your team to identify unique opportunities or marketing action steps for your practice. For example, is your practice structured to meet the population trends you've identified? If not, what changes might you pursue to better meet these needs and trends? Do you offer specialized services or diagnostic tests in your office, or do you have areas of expertise to help meet unique population needs? If retirees are moving into your area, do you offer services or amenities for older patients, for example? If your community is attracting young families, do you offer services of value to them, adolescents and/or women of childbearing age? These and other questions will help your practice begin to shape itself as one poised and ready to take on the population needs in your community. Now, let's look at how to use secondary research to gather information specific to your patients and their experiences with you. Once again, we're going to turn to online resources. Reviews are a great place to start. Google reviews are very accessible. Google your name or practice to view what patients write about their experiences with you. Yelp also provides this kind of insight. Although reviews on Yelp sometimes skew negative, the comments can be very helpful as you establish practice services and capabilities. Other sites that provide important information, ratings, and reviews include ZocDoc, Healthgrades, U.S. News and World Report, and even those provided, again, by your local hospital affiliations. If your practice has social media sites or a website, these can also reveal important attitudes and perceptions that patients have about your practice. The advanced curriculum of this marketing series will explore this in greater detail and will help you understand the value of an online presence and how to establish it efficiently and effectively. Stay tuned for more information on the advanced curriculum of this marketing series. As you read through all of this information on these sites, consider the kinds of information that can help you better understand your patients, their perceptions, and experience. Look for the quantity of reviews. While quantity doesn't directly convey a positive or negative patient experience, a large pool of positive reviews can help offset negative ones, which are inevitable. People tend to complain more quickly than they compliment. To generate more significant numbers, you may want to encourage patients to post reviews when they have had a good experience. Take note of the average rating. On any review site, you want your rating to be as close to the top as possible. For example, you want your average rating on Google to be between 4 and 5 stars. Interestingly, 5-star ratings are sometimes perceived as too good to be true, so a rating between 4 and 5 indicates an honest, reliable assessment. Read all the comments. Comments can provide you with vital insights into the specific issues that drive ratings. For example, a patient may give you only a 3-star rating, but through their comments, you may realize that the wait times were more problematic than the care, for example. That's helpful information. Use both positive and negative comments to identify attributes you may want to promote or issues you may need to address. Monitor trends. If you've made any changes in your practice based on insights, watch for the trends in the ratings and/or comments. Did they improve after your changes were made? Finally, take a look at the level of engagement with any social media sites that your practice manages. Which posts generate the most likes, comments, and shares? Do your patients follow you and respond more to health and wellness information or to other posts introducing new providers or services? What types of health information generate the most interest? Use these insights to enhance your social media presence, which can also help you build and maintain long-term, productive patient relationships. As you go through all this information available to you online, consider these kinds of questions. Are you generating reviews? Are they positive? Today's consumers rely heavily on reviews to make their choices, so this is important to monitor regularly. Are there positive themes to build upon to benefit your practice? Are there negative themes that your practice needs to address? Donna will now walk you through what all of this means for your practice and provide you with exercises that will be helpful for you and your staff.
Thank you, Rob. So now that you've gathered all of this information and you've begun to think about your practice in light of the needs of your community and patients, let's bring all of that together. You will want to assess how your practice is aligned or could be aligned with the people who need your care. In the Learning Guide, there are 2 grids for you to use as tools for listing your research results, the key findings, and the marketing implications for your practice. Let's take a look at a practical application of these grids. This is just one example of the process you can use to move from knowledge to action. So looking at your research findings, let's assume that you found some valuable insights in your local hospital's community health needs assessment. That hospital prioritized lung cancer prevention and early detection because of the high rate of smoking and the low use of CT screening in the community. So you are likely already aware of this need, but does it point to anything additional that your practice could offer or any steps your practice should take clinically? For example, does your waiting room or website offer comprehensive information for patients about area smoking cessation programs? Or do your team members make referrals for low-dose CT lung cancer screening for all patients at high risk? Now, implications for practice marketing come from looking at this and how you could differentiate yourself from your competitors based on this insight. So you may decide that you want to take several steps to position yourself as a leader on this important topic for your community and your patients. You could consider partnering with your local hospital or with the area's chapter of the Lung Association or American Cancer Society on smoking cessation programs or lung cancer awareness initiatives. You could participate in high-visibility health fairs in the area, paying significant attention to educating people about the importance of lung cancer prevention and early detection. You could leverage social media, your website, and any blog posts that you create to take a position on this issue and establish your practice as a valued resource on the latest information on these topics. Or you could consider a special educational event or partnership opportunity during Lung Cancer Awareness Month in November. You can use any of the relevant findings from your secondary research to identify action steps and marketing or communication opportunities. The findings could be related to the age, ethnicities, or unique health needs of your community, or they could relate to an issue you've identified with your patient satisfaction levels, either from access to attitude. Gather the information, review it all with your team, think through what the findings mean for you, determine your marketing tasks that will be valuable, and prioritize how you leverage these tasks to enhance your market position, as we discussed in Primer 1. From a secondary research point of view, you are well on your way. Now let's look at the kind of primary research that makes the most sense for provider practices. Primary research, such as online market surveys and focus groups, are often used to identify baseline insights and trends across a region. For provider practices, primary research like this is generally unnecessary because secondary research can really give you all the information you need. However, there is one type of primary research that you will want to use in some way to understand what your patients are thinking and experiencing on an ongoing basis. Patient satisfaction surveys, which are forms of primary research, are invaluable tools to ensure that you are consistently meeting or exceeding patients' needs and expectations. Here are 4 straightforward steps to developing and implementing your patient satisfaction survey. The first step is to set your goals. Identify what you want to know from the survey. You'll find some ideas for this in the review of the secondary research you conducted in assessing your patients' perceptions. For example, what trends did you find in the comments and reviews online? Did they revolve around access, or appointment scheduling, or were they more focused on provider attitude? When patients compliment your practice or your team members, what words or phrases do they use most? Kind, caring, listened to me, took their time, explained clearly. Using these insights, determine what you most want and need to know about your practice to help you build on strengths and address any weaknesses. Step 2 is to create your survey. You want to keep it brief, about 5 questions. You should use both closed and open-ended questions. So as a reminder, an example of a closed survey question would be, on a scale of 1 to 10, how would you rate your provider's ability to explain your diagnosis and treatment clearly? An open-ended question might be, what other services could we offer to help you better manage your health or improve your experience? Step 3 is to determine your distribution method or methods. So start with your patient portal. If you're using one, there is very likely a survey tool built in for sending information and follow-up questions to patients. You could also consider texts and emails. If you send patients follow-up text messages or emails after an appointment, you could include a link to a survey in those communications. Another approach is to offer patients a survey encouragement or request card at the time of their visit. When a patient has a positive experience, your team members could offer this card to the patient. The card could include the full, short survey, and it could be completed in the office and dropped into a survey box. It can also include a QR code with a link to the survey that patients could complete online at their own convenience. Finally, consider using posters in your office to encourage patients to take the survey. Use language like, "We want to hear from you," or "Your opinion matters to us." The final step is to follow up. To ensure that your team members can appropriately follow up on both positive and negative comments, you can allow patients to include their name and contact information if they choose. If they do offer contact information, be sure to send a thank you note of appreciation when you receive positive comments. On the other hand, call or email patients as quickly as possible after receiving a negative review so that you can learn more, reassure the patient about steps taken to avoid such an experience in the future, and you can do some service recovery to keep the patient part of your practice. Ask for permission to include any positive comments and materials throughout your office so that you can encourage others to share their perspectives. Finally, regularly review the survey responses with your team. These responses can be used to give team recognition and kudos as appropriate, and it can also be used to guide discussions around changes that need to be made within the practice. When you're creating your survey, here are some categories of information you may want to consider to guide the questions that you choose to ask. So, ease of finding a physician online and making an appointment. The attitude of the care team. Ease of access, for example, your location, parking, or signage. Wait times in your office and in your exam rooms. Clarity of communication from providers. Providers' bedside manner. The overall patient experience. Patients' willingness to recommend your practice to others. And finally, areas for improvement. Rob, back to you.
Well, thank you for joining us today. This was Primer 2 in the marketing series that focused on the role of market research in helping you identify and strengthen your unique position in the marketplace. Additional primers will discuss community outreach, public relations, social media, and digital tools to help you retain current patients and attract new ones. A reminder, too, that an accompanying learning guide is available for this and all primers that will provide your team with exercises they can conduct to better understand your marketing advantages. Thank you very much for joining us, and we'll look forward to talking with you again in future marketing primers.